my name is Nora. I'm going to be the nurse doing your physical assessment today. Okay. I've washed my hands, provide patient privacy, close the door. I'm inspecting for any environmental hazards. Can you tell me your full name and birthday?
Kyle Ballinger, August 21st, 1980.
Information the patient has given me matches the patient's chart. Can you tell me what day it is?
Sunday.
And where are you right now?
The doctor's office.
And what month is it?
May.
Patient is alert and oriented, answering my questions appropriately. He seems to be in a pleasant mood. Nutritional status and hygiene status both seem to be within normal limits. I haven't observed any environmental hazards around or on the patient, as I've noted before. We already took the patient's vital signs today. We did a blood pressure, radial pulse, pulse oximetry, measured his respirations, took his temperature, and those were all within normal limits. I'm going to ask again, are you having any pain today?
No, I'm not.
Great. So I'm going to be doing a physical assessment, and it requires me touching you, some light touch. Nothing should hurt. If it does, you let me know and we can stop.
Okay.
Okay? Do I have your permission to continue?
Yes.
Great. So have you noticed any blurred vision lately?
No.
Sore throat?
No.
Runny nose?
No.
Cough? Anything like that?
No.
Drainage from the eyes or ears more than normal?
Mm-mm.
Okay. Patient's head, face, neck seem to be symmetrical. Eyes are equal in size and shape, as are the ears. The nose is midline. There's no deviation of the bridge. Mouth is intact. Neck looks supple. Trachea is midline. No deviations noted. I've gathered my equipment, and I've made sure to clean it off. I'm just going to shine a bright light in your eyes. Make sure to keep your gaze forward and try not to blink, okay? And follow this pen. Don't move your head, just your eyes, okay? At any point, did you notice any double vision, blurred vision, or did you lose sight of this pen during that exam? Okay. Cranial nerves 1 and 2 are deferred. Cranial nerves 3, 4, and 6 are intact. Patient has displayed 6 cardinal signs of vision, and pupils are equal, round, and reactive to light. Okay, clench your teeth for me. Cranial nerve 5 intact. Big smile, frown, raise your eyebrows, shut your eyes really tight, open them again, just relax, puff your cheeks out, and purse your lips. Cranial nerve 7 is intact. Stick your tongue out for me. And say, perfect. Say again. Okay, uvula is midline, no deviation. Patient isn't drooling or experiencing any aphasia. Cranial nerves 9 and 10 are intact. 8 is deferred. If you would shrug your shoulders, cranial nerve 11 intact, and stick your tongue out. Cranial nerve 12 is intact. We're going to go ahead and take your shirt off so I can do a respiratory assessment. And if you would turn around and have a seat on that stool. When I place my hands on your back, just say the words 99.
99, 99, 99, 99.
Just relax. Okay, great. You can turn back around. Tactile firmness produced light vibrations, and percussion produced a resonant sound over all lung fields. Those are both within normal limits. Actually, turn back around. I'm sorry. When I place my stethoscope on your skin, just take a nice deep breath in and out, okay? Great. Okay, turn back around. And I'm going to take a listen to the front, okay?
Okay.
Just relax. Bronchovesicular breath sounds noted in all lung fields, both anterior and posterior. If I were to auscultate the trachea, I would hear bronchial breath sounds over that area. And have you been having any chest pain recently?
No.
Any palpitations?
No.
Any cardiac history in your family?
No.
Okay. I'm observing the patient's precordium. I don't see any abnormal movement. I'm just going to place my hand on your chest, okay, sir? Okay, I'm feeling for a thrill, which I do not note. And I can palpate an apical pulse. I'm just going to take a listen to your heart, okay?
Okay.
Great. I assess the aortic valve, right sternal border, second intercostal space. S2 is greater than S1. Pulmonic valve, left sternal border, second intercostal space, S2 greater than S1. Erb's point, left sternal border, third intercostal space, S1 is equal to S2. Tricuspid valve, left sternal border, fourth intercostal space, S1 is greater than S2. And mitral valve, left chest, fifth intercostal space, midclavicular line, S1 is greater than S2. Have you been experiencing any nausea, vomiting, diarrhea?
No.
And how has your appetite been?
Good.
Okay, if you will lay down for me. On inspection of the patient's abdomen, I noticed the skin color, the temperature, it's warm and dry, no asymmetry noted. I do see a surgical scar. The patient has a history of intussusception for which surgical intervention was needed as an infant, and I do see some scarring on the right upper and right lower quadrant as well as the right flank. The patient does have a history of morphia. It is a form of scleroderma that affects the integument. Have you had any new hardened patches of skin appear on your anywhere on your body?
No.
Okay, great. So that continues my integumentary assessment, which I started at the beginning of this assessment, and I will continue through the end. I am just going to take a listen to your abdomen, okay?
Mm-hmm.
And I'm also auscultating the abdominal aorta. And I do not hear a bruit. Normoactive bowel sounds heard in all four quadrants. Intermittent high-pitched clicking. I'm going to just put this. Okay, tympanic sounds heard over all four quadrants on percussion. And I'm just going to lightly touch. Okay?
Okay.
Lightly press. You tell me if you have any pain or discomfort, okay?
No pain.
Okay. No pain or tenderness. Belly is soft and non-tender. No rigidity. No guarding. No palpable masses noted. I'm going to palpate your bladder. You might feel a little bit of pressure. Okay. Bladder isn't distended. Have you been having any frequency of urination, especially at night?
No.
Any burning when you pee?
No.
Patient provided a urine sample earlier today. I will take a look at that and note the color and the clarity of the urine as well. Just remain lying for me. I don't notice any swelling or redness of the patient's joints. Any joint pain or musculoskeletal pain recently?
No.
No sports injuries or any
No.
other injuries like that? Okay, so if you would just relax for me.
Okay.
I'm going to lift this leg up. Okay, just relax.
Mm-hmm.
Okay, any pain?
No.
Okay, relax your ankles for me. Push against me. Pull your toes up. Great. Lift your left leg up. Back down. Lift your right leg up. Back down. Continue to relax. Any pain? Discomfort?
No.
Okay. Any pain or discomfort?
No.
Okay. In terms of lower extremities, full active and passive range of motion in the hips, knees, ankles. Lower extremity strength is strong and equal bilaterally. You can have a seat again. Okay. And if you would touch your chin to your chest, extend your neck up to the left, to the right, side to side. Yep. Side to side. Good. Any pain or discomfort?
No.
All right, great. I forgot to do this earlier. I'm just going to feel your pulses, okay?
Okay.
Tympanic pulses are equal and strong. Carotid pulses are equal and strong. Brachial pulses are equal and strong. Radial pulses equal and strong. Femoral deferred, popliteal equal and strong. Dorsalis pedis equal and strong, and posterior tibialis equal and strong. If you would, arms out to your side, behind your head, up over your head, behind your back. Any pain or discomfort with that?
No.
Okay, arms out to your side again. Meet my resistance. Meet my resistance. Arms out in front of you, palms up. Squeeze my hands. Grip strength equal, strong in both upper extremities. Flex and extend your elbows a few times. Any pain or discomfort?
No.
Keep them upright at a 90-degree angle. Meet my resistance. Good. Meet my resistance. Good. Any pain?
No.
Okay, great. If you would, really quickly, palms to your thighs and then the backs of your hands to your thighs. Back and forth really fast as you can. Great. You can relax. I want you to touch my finger with yours and then to your nose over and over again, okay? Okay, great. Other hand. Okay, great. If you would stand up for me and close your eyes, arms out to your sides, finger to nose, alternating hands. Faster. Great. Keep your eyes closed, arms down, just relax. I'm going to observe my patient for 20 seconds for the Romberg test. No any swaying or the patient taking a step to maintain his balance. The patient has passed the Romberg test. Great. You can open your eyes. Any dizziness,
No.
vertigo-like symptoms? Great. Take about 8 to 10 steps forward for me. Okay, and then turn around and heel to toe. No gait disturbance noted. Patient maintained his balance. Any complaints during that?
No.
No dizziness? You didn't feel like you were about to fall or anything
No.
like that? Okay, great. This concludes the head to toe assessment. You can get dressed. I'm going to perform my hand hygiene. I will make sure to record everything, all of my findings, provide patient privacy, and that concludes my assessment.